I want to talk today about, to give you more details about the next rollout of the vaccine. And let me just look at some numbers here. We're showing today 221,208 of your fellow Ohioans have received the first dose of the vaccine. We are moving forward, and we're clearing up, we think, most of the problems, the technical problems of getting the data in. I think our partners are working very hard. The hospitals are working hard. Pharmacy partners and our local health departments are working hard to get these vaccines in people's arms just as quickly as they can. So let me talk about the next phase of this and where we will be going. And the 1A will, in some cases, continue. For most hospitals, next week, vaccine should take care of their first responders, their individuals who are in that hospital system, who are frontline workers and are dealing directly with people in COVID. We're monitoring this, looking at the numbers, and our team constantly adjusts what goes to each hospital. But next week, some of these hospitals will be finishing up that phase. And so in some cases, portions of the 1A will be concluding. Some of it will continue on, particularly in regard to the second shots that will need to be allocated. So that will continue. Let me talk about 1B and the beginning of it and give you some specifics. On Tuesday, January 19th, vaccinations will be available to those who are 80 years of age and older. We will start with our most vulnerable, where we've seen the most tragedy, the people in this state who have the most risk of death if they get the COVID. That is people in the general population, not people in nursing homes. We're already working that through. But people who are 80 years of age and older. We believe that those individuals are somewhere in the neighborhood of 420, 450,000. We are also, as I indicated last time, receiving about 100,000 for those several weeks, doses per week. So obviously not everyone who's 80 is going to be able to get it that week, but we wanted to set aside 1 week where nobody else could get it except based on age, except those 80 years of age or older. Those receiving vaccines will receive them from, in some cases, physicians, from local health departments, hospitals, federally qualified health centers, in-home health service providers, as well as some of our retail pharmacies. Now, the Department of Health has approximately 1,700 providers already registered to distribute vaccines and will add more. However, when we go to the date of January 19th, not all of these providers will have the vaccine. What we have to do is distribute it through 88 counties. We have to do it in an efficient way. We want to make it accessible, but we also want to make sure it gets out very, very quickly. So as we move forward, there will be additional ones that will be added. But the first, I'll tell you in a moment about the first week. So this coming Monday, we will hold a webinar for registered providers. That will outline our expectations and our instructions for distribution. On Tuesday, those who have been selected to deliver vaccinations the first week will be notified. And they will know on Tuesday that they have been selected to administer these drugs, this vaccination the first week. And they will receive information about the size of their allocation. Now, as I said, there are more providers registered than will initially receive vaccinations, but we will add providers as more vaccine comes available. Again, what drives so much of this is a scarcity of the vaccine. So 100,000 is roughly what we think we'll have for this group the first week. Let me continue on the week. On Wednesday and Thursday, we are asking local emergency management agencies in every county of the state to hold a press conference announcing where vaccinations will be available in their counties and how individuals can receive them. Some providers may require appointments. Some may hold drive-up clinics we can drive through. Some may have walk-in, walk-up clinics. So some you'll have to make reservations for, or schedule, some you will not. We expect every provider to clearly state how they will administer vaccinations to eligible individuals. Further, on Thursday, we will launch an online tool on coronavirus.ohio.gov, where individuals will be able to see who is distributing vaccinations in their counties to what eligible group. And the first week will be those 80 years of age or older. Again, as more vaccinations are available, more providers will be added. So, how can you find out about this? You'll see it in your local news media. TV, radio, newspapers will provide that information. You will also be able to look on the webpage of the state and look that up as well. So there'll be opportunity for people to be able to see where it is in your county. Now, vaccines are usually delivered from the manufacturer on Monday, Tuesday, and Wednesday of each week. Sometimes there has been a day delay. We cannot control that, nor can the provider control that. We anticipate those providers that receive their vaccines on Monday, January 18th, will in all likelihood start distributing on Tuesday. Those that receive them on Tuesday will begin to be distributed on Wednesday. And those received on Wednesday, we anticipate will be administered beginning on Thursday. So again, that's information that the provider will know. They will know what day they're scheduled to get it. They'll know how much they're supposed to get. And assuming they get it on that day, they will be able to proceed the next day to vaccinate people. But the instructions of how to do that will come directly from that provider, whether it's a health department or whether it is a retail pharmacy or whoever that might be. So clearly, with up to 420,000 people or so, 80 years of age and older, and with only 100,000 doses available for the first week, it will take a number of weeks before those 80 years of age will be able to get their vaccine. Now, every week after that is our plan, and we'll have to see how this goes, and we'll have to see how the distribution goes. But the plan is, and again, it will depend on how much vaccine is coming in to the state of Ohio, which we do not control. We think we know how much is coming in, but we cannot control that. So each week we will add 5 years. So on January 25th, we anticipate vaccinations will open up to those 75 years of age and older. So the 80-year group will still be able to get it. Now we'll go down to 75. Anybody 75 and older, that week will phase that in. The following week, it will open up to people 70 and older. And February 8th, the vaccinations, we hope, will be able to be available to those 65 years of age and older. Now, again, this is going to take some time. The whole group of 1B is about 2.2 million. So when a new age range opens, that just certainly does not mean that vaccinations will be completed for the previous age group. We know they will not. Again, it will take a number of weeks to distribute all the vaccine given the limited doses available. we hope that the number of vaccines coming into Ohio will increase. The week of January 25th, vaccinations will be available to those with severe congenital, developmental, or early onset medical disorders. We will announce in the coming days how those individuals will be able to receive their vaccination if they choose. So we're not announcing that today, but we will. And we will announce how they will know when they will be able to get the vaccination. I mean, we're telling them when, we're not telling them yet where. Again, the week of January 25th, vaccinations will be available to those in that category. More information will follow next week. Then, during the week of February 1, we will begin to vaccinate our school personnel. This week, we are sending forms to be signed by superintendents. And we are asking them if they will agree, if their school will agree to be open beginning March 1st. Now, many schools are already open, so that won't be an issue for them. Many schools have been open, have closed, and back open. Well, our goal is to have every school child in school by March 1. So we will announce, during the week of February 1, as I said, we'll begin to vaccinate our school personnel. This week, we're sending forms to be signed by superintendents, and we're asking them on behalf of their school to agree to be back in person or hybrid by March 1. And that is a condition. If they sign that, then we will be able to provide them, people who work in the school, with the vaccine. Again, the justification, the reason for doing this is very simple and singular, is to get kids back in school. We will also be asking schools to send us the number of staff they believe will choose to take the vaccination and indicate if they are already working with partners for vaccine administration. Some schools we know are already working with partners. We just need to know that. If they don't have a partner, then we will help them get a partner for that vaccination. So again, a work in progress, but we will work with the schools. But first we need to know how many of your people who work for you in that school building want to take it, and will you agree to go back to school March 1? Again, many of your schools are open already. That's irrelevant then. Basically then, we just need them to sign it. And then, again, the number of people who will in fact be wanting to take that. And then finally, to let us know, do they have a partner? And if they have a partner, that's fine. Then we know who the partner is. We work through the partner to get the vaccine to them. If they don't have a partner, we will work with them to get a partner. Again, the logistical lift of this distribution is unprecedented, determining recipient groups, population amounts, provider types, as well as identifying individuals to administer the vaccine, assessing storage capabilities is important, handling requirements, awaiting shipment notification and distribution plans from the federal government all have to be worked in by our team. I want to thank our team. They've done a good job for planning this and working on this. So that's the information for today.